In Walmart's Nouville, time was ticking away. Only a few nights left till the big holiday. But last-minute gifters had no need to worry. Walmart Express Delivery got their gifts in a hurry. From Nintendo to Nespresso and Lego flowers, they could check off their lists in as fast as an hour. All of Nouville, East, West, South, and North, could order gifts up until 5 p.m. on December 24th. So this holiday, just do as the Who's do. With gift delivery this fast, they all gasped. From Walmart? Who knew? Subject to availability, terms and fees apply.
Oh, Hilton stay, your beds are soft and cozy. No lumpy couch, no stiff futon, no shower line at crack of dawn. Oh, Hilton stay, a holiday you're saving.
When you want holiday comfort you can count on, it matters where you stay. This season, enjoy spacious, comfortable rooms and friendly service when you book with Hilton instead. Hilton for the stay.
This is Dr. Ted O'Connell with the Med Prep to Go Step 2 podcast. Today we'll be reviewing 3 neurology questions. Just a reminder that you can find these questions and many more at medprep2go.com. If you'd like to get involved in helping us to develop questions for this free question bank, please email me directly at ted.medprep2go@gmail.com. If you like what we're doing, please subscribe to the podcast, give us a review, and let your friends know, as all of this helps us quite a bit. All right, let's go ahead and get started with the first question. A 61-year-old woman with a history of osteopenia managed with calcium and vitamin D supplements and a history of hypothyroidism on levothyroxine comes to a local walk-in clinic after a potential COVID-19 exposure. She gets a PCR nasal swab and is informed that the results should be available within the hour. While waiting for the results, she develops a headache that she describes as a tight band around her head with some tenderness in her shoulder muscles. However, once the results return as negative, her headache slowly begins to improve. Which of the following is the most likely etiology of her headache? A, bacterial meningitis. B, tension headache, C, cluster headache, D, migraine headache, or E, subarachnoid hemorrhage? The correct answer is B, tension headache. The take-home message in this question is that common symptoms of COVID-19 infection include fever and chills, cough, shortness of breath, fatigue, muscle and body aches, headache, a new loss of taste or sense of smell, sore throat, congestion and or runny nose, nausea or vomiting, and diarrhea. Some studies have shown that patients with COVID-19 may even get a headache before they notice any breathing or respiratory problems. Pounding headaches can continue for weeks or even months after an individual tests positive for COVID-19. Headaches are one of the most common symptoms being experienced by a group known as COVID long haulers, or those with lingering issues related to the SARS-CoV-2 infection. However, in this patient, given the negative PCR result and the classic description of a headache in the setting of the patient being stressed and sleep deprived, likely makes this a tension headache. This is not a cluster headache, which typically occurs in cyclical patterns or cluster periods. Cluster headaches can awaken individuals in the middle of the night with intense pain in or around one eye or on one side of the head. The bouts of frequent attacks, known as cluster periods, can last from weeks to months, usually followed by remission periods when the headaches stop. This is unlikely to be a migraine headache, which classically presents with severe throbbing pain or a pulsing sensation, usually on one side of the head. It is often accompanied by nausea, vomiting, and extreme sensitivity to light and sound. Migraine attacks can last for hours to days, and the pain can be so severe that it interferes with one's daily activities. For some people, a warning symptom known as an aura occurs before or with the headache. An aura can include visual disturbances, such as flashes of lights or blind spots, or other disturbances, such as tingling on one side of the face or in an arm or leg, and also with difficulty speaking. This patient's presentation is not classical for bacterial meningitis or subarachnoid hemorrhage, both of which can present with meningismus, which is a clinical syndrome of signs and symptoms that are suggestive of meningeal irritation. Symptoms may include photophobia, neck stiffness, and seizures. Question 2. An 88-year-old man is brought to the emergency department for slurred speech, altered level of consciousness, and left-sided facial droop. The family reports that the patient was fine last night, but they noticed changes in his behavior when he awoke in the morning. They thought that he might be better on his own, but then they noticed the slurred speech and facial droop. In the emergency department, the patient has a National Institute of Health stroke scale, or NIHSS, score of 5. A CT scan is ordered and is read as normal. Neurology consultation is obtained, and an ischemic stroke is suspected. The neurologist does not recommend giving tissue plasminogen factor, or TPA. Which of the following provides the best reason why TPA should not be given to this patient? A. Giving TPA is not indicated in patients with a normal CT scan. B. Giving TPA outside of the 4.5-hour time window can cause reperfusion hemorrhage. C. Giving TPA outside of the 4.5-hour time window will not be effective in dissolving the clot. D. Giving TPA outside of the 4.5-hour time window will not be effective in salvaging neurons inside the core region of ischemia. Or E. Giving TPA to an 88-year-old man is contraindicated due to age. The correct answer is B. Giving TPA outside of the 4.5-hour time window can cause reperfusion hemorrhage. In situations of ischemic stroke, TPA is one of the only pharmacologic agents that can help reverse neurologic damage. However, during the time of ischemia, damage to the vasculature can occur. When reperfusion occurs after administration of TPA, the blood vessels that were ischemic are weak and can hemorrhage. Additionally, TPA can augment the activation of endogenous matrix metalloproteases during the phase of inflammation. This results in breakdown of the extracellular matrix and a further weakening of the blood vessels. Answer A, giving TPA is not indicated in patients with a normal CT scan, is incorrect. Ischemia does not show up on a CT scan until several hours after the event. It is actually preferable to have a normal CT scan, as this would indicate that the event happened more acutely. It confirms no bleeding is present, and the patient could potentially be a TPA candidate. Answer choice C, giving TPA outside of the 4.5-hour time window will not be effective in dissolving the clot, is incorrect. TPA is able to dissolve a clot outside of the time window of 4.5 hours. Answer choice D, giving TPA outside of the 4.5-hour time window will not be effective in salvaging neurons inside the core region of ischemia, is incorrect. The neurons within the core region of ischemia will likely not survive regardless of TPA treatment. So this is not a good reason to withhold treatment in this case. The use of TPA is effective in preventing further spread of neuronal death. Answer choice E, giving TPA to an 88-year-old man is contraindicated due to age, is incorrect. There are no contraindications to TPA due exclusively to age. The key learning point in this question is giving TPA outside of the 4.5-hour time window can cause reperfusion hemorrhage.
When the holidays start to feel a bit repetitive, reach for a Sprite Winter Spiced Cranberry and put your twist on tradition. A bold cranberry and winter spice flavor fusion, Sprite Winter Spiced Cranberry is a refreshing way to shake things up this sipping season, and only for a limited time. Sprite, obey your thirst.
Does it ever feel like you're a marketing professional just speaking into the void? But with LinkedIn ads, you can know you're reaching the right decision makers, a network of 130 million of them, in fact. You can even target buyers by job title, industry, company, seniority, skills, and did I say job title? See how you can avoid the void and reach the right buyers with LinkedIn ads. Spend $250 on your first campaign and get a free $250 credit for the next one. Get started at linkedin.com/campaign. Terms and conditions apply.
Question 3. A 53-year-old woman presents to the emergency department appearing disheveled, diaphoretic, and anxious with tremulous hands. Upon examination, she reports being homeless for the past 2 years, and she denies drug use but admits to alcohol use. She thinks the current year is 2008, though it is 2023. She states that she has a history of a liver issue. She currently feels nauseated, agitated, and complains of headache that is diffuse. Vital signs are blood pressure, 146/82 millimeters of mercury, heart rate, 121 beats per minute, respirations, 23 per minute, temperature is normal, and oxygen saturation is 98% on room air. During her evaluation in the emergency department, she falls on her way to the restroom, landing on her buttock. It is noted that her gait is wide and slow. Her head is atraumatic after the fall, but she's noted to have difficulty controlling her eye movements, and her oral mucosa is dry. Which of the following is the most likely diagnosis regarding this patient's presentation? A, acute stroke. B, methamphetamine intoxication. C, Wernicke encephalopathy. D, opioid overdose. Or E, serotonin syndrome. The correct answer is C, Wernicke encephalopathy. This patient's presentation is most concerning for Wernicke encephalopathy, with a medical history of alcohol use and possible liver disease. In a patient with poor nutrition caused by conditions such as chronic alcohol abuse and anorexia nervosa, Wernicke encephalopathy is a major concern caused by thiamine deficiency that can lead to severe neurologic damage. Wernicke encephalopathy is described by the triad of encephalopathy, oculomotor dysfunction, and gait ataxia in a patient with alcohol abuse. Patients usually present with a wide, slow, and unsteady gait. Large case series have found that the classic triad is only present in approximately 30% of patients. Looking for all features of the triad will lead to the condition being underdiagnosed or misdiagnosed. The key learning point to this question is Wernicke encephalopathy is described by the triad of encephalopathy, oculomotor dysfunction, and gait ataxia. The ataxia tends to present earlier than the other symptoms by a few days to even several weeks. Do not look for all the features of the triad in order to diagnose Wernicke encephalopathy. The disease is difficult to confirm, so any patients with presentations concerning for possible Wernicke encephalopathy should be administered thiamine immediately. Okay, so that's it for this episode, but please do check out our other episodes and all of our content at medprep2go.com. If you find the content of these questions to be helpful, please do check out the USMLE Step 2 Secrets podcast, where all of this content is covered in much more detail.
Been out here all morning. Not a single bite. Guess the fish finally figured it out. Just like hackers do when Cisco Duo's on guard. With Duo's end-to-end phishing resistance, every login, every device, every user stays protected. No hooks, no catches, no bites. Cisco Duo. Phishing season is over. Learn more at duo.com.